thank our sponsors. Pfizer, Takeda, and CSL had helped with some financing so that we can help provide breakfast on Monday morning, as well as some hotel rooms for folks who are traveling out of town. So thank you to them. If you see them, some of them will be joining us on Monday, and some of them you'll see later down the road. So we just really appreciate all their support. Freddie had mentioned initially we were hoping to get Delegate Tran to do a video to welcome us, but she will be there on Monday to greet us. So we look forward to seeing her then and letting her know our appreciation for all the work that she does. For those of you who aren't part of the hemophilia group, typically on our advocacy trainings and groups, we like to get a sense of kind of what the federal issues are, what's going on, how could they impact us, what do we need to be thinking about when we go to meet our state senators and delegates based on what's going on for federal. And we are thrilled to have Josie here, who's with the National Bleeding Disorder Foundation, who's going to give us kind of a brief overview of the federal landscape and provide an update about what's going on there. So I'm going to go ahead and turn it over to you, Josie.
Yes, well, thank you. Again, my name is Josie Gomez. I'm with the National Bleeding Disorders Foundation. I'm actually substituting for Matt Delaney. He's a part of our team. So our team is a small public policy team. So we divide the map up. Matt has the eastern portion of the country. Bill Roby is on the western side. He's in Oregon. I'm in Austin, Texas. So I take the southern portion of the map and Puerto Rico. But, we all work together as a team to try to help each other out. And of course, our message is always all the same across all our chapters. One of the things Matt wanted to make sure that I shared with y'all, as far as federally, right now we have our big push is our help copay legislation that's happening in DC. We currently have 106 House sponsors on that bill and 17 co-sponsors in the Senate. We're trying to hopefully increase that number by an event that we're having on March the 6th through the 8th. It's Washington Days. And so we're really excited because we're all going to go up to DC and make a big push that way, because we'll have folks from all over the country of our chapters come together. So we're excited about that, especially right now because Congress, y'all, is a bit of a mess. Congress is still trying to fund government both in the short term and long term. We have a continued resolution in place right now that'll help towards short-term funding. But as far as long-term funding, y'all, it's a kind of wait and see game. So we have our folks that are, watching it closely. Anything that changes up there, they let us know. And then of course we pass that information to y'all. That's why we want to push big on Washington Days, because what we are trying to do is help pass legislation in each one of our states, so that way, when we do go up to DC and we do meet with our legislators, it's so much easier for us to pass that bill. Perfect example is y'all in Virginia. Since y'all have passed the copay accumulator bill, which I know is very hard. Here in Texas last session, man, we struggled, but we got it passed. So that's basically what our team is doing. I'll be in Oklahoma, then I'll go straight to, Oklahoma, Missouri, and then South Carolina. So we're hitting all our states like y'all are doing on Monday. We go out there and we're trying to help them push for those states who still haven't passed it. And we're right now, the momentum is high. We're really close in Missouri to getting that done. South Carolina is gearing up. They're really rolling with it. One of the main things that we want to push states to pass it is, for example, y'all, that when we do go up to DC and we're trying to push, this bill, it works in our benefit to have all of these states pass it, because when we meet with the members of Congress, it's easier for us to get their support when we say, hey, Congressman, this bill has already passed back in your state. Your constituents want this. So therefore, we're asking for support. I looked on the list and I saw a couple of Virginia Congress members that already signed on to the bill. So we are going to try to push and have those folks that haven't signed on yet. What we do is we schedule meetings with your respective member of Congress, and then you all go in there. Usually folks get a little bit intimidated when they go up there and they're like, well, I don't know what to say, or, they get nervous. We have a whole training session, kind of like what y'all are going to do today, but they're in DC, about what to say and how to tell your story. People get nervous about the intricacies of the bill, which is a lot. I'm a former staffer. I worked at this Texas Capitol for the last 17 years before coming on board here. So as far as like the intricacies of the bill and stuff like that, there'll be a subject matter expert always there with you that'll handle that part. But where you all are, the most important part is when you all go in there, because you all are the community members, you all are the constituents, you all are the ones that get to tell your story. And so a lot of folks are like, Josie, I don't know really, what to say. And so we just get to talking because no one knows your experience and what you deal with better than you do. And when you go in there and you tell that story, y'all, it's undeniable. It's undeniable how quickly these members of Congress or even your state legislators back home, once they hear the message and they see how it affects y'all, the change comes quickly. So this is what we're hoping to do and have that big push. Right now, we currently have 22 states that are pushing the copay accumulator bill. So we're trying to get all of those folks out there, getting that passed. Thus far, we have 19 states that have passed it in Puerto Rico. And so we're trying to get more up there. When we get to DC, we're hoping that after we have these meetings, that push will come as well. So that's mainly our big focus right now. And Matt told me that a bunch of y'all might be going up there to Washington Days. I saw y'all registered. So we're really excited because the last time we checked on the numbers, I think this is like the record high of folks that we have coming to DC, which I absolutely love because, I mean, first of all, like the in-person, like y'all haven't been in person at y'all Capitol, but when you get together and you're there face to face, it's a different energy. And then like getting chapters that, you would normally not talk to, and like from different areas of the map, and people are sharing ideas like what worked for you over there, what didn't work, what can we do to help? That's the best part. The last year when I was up there was the second year I had been up there. And y'all, there's just like an energy about when we're all walking up to Capitol Hill and everybody's there like with the, like the same, like, like we're gonna get this done. We're here. It's just an amazing energy. And it's like the hearing everybody's stories and relating. And this is why it's so important that you all keep doing what you all are doing. And like I said, it's the Washington Days. If you can't make it this year, we'll be doing it again always. We have it kind of like a sessional kind of thing that's going on. And so hopefully if you can't make it this year, you'll make it next year. But we have a great agenda set we have speakers coming in, training sessions. It's a really good time. And I'm glad that y'all are going on Monday so y'all can get a feel for it. And like, this is what I always tell everybody. If you can, take your kids. Kids are the best little advocates for this. I was in Oklahoma and I was preparing to, to give my spiel on the bill. And there's this cute little boy. He's like 9 years old, Jaden. I'm sitting there and he, we all introduce ourselves. Jaden pops up, y'all. He has his little vial. He puts it on the desk of the senator and goes, "Can you guess how much this costs and how often I have to infuse?" That senator was like, "Excuse me." By the end of our advocacy day, that member had gone and signed up for our bill. That's how important it is to say your message and to just like, that's why anytime that we're out there in meetings and there's kids, I want those on my team because they can't say no to those little faces. So, but yeah, like I said, Matt wanted me just to touch base a little bit on Washington Days and what we're doing. And hopefully we get to see you all there in person.
Thank you so much, Josie. And I think she's right. I think one of the things I remember one of the first times I went to Washington, but I think that same energy is in Richmond, and it's going to be kind of exciting having the new General Assembly building that we've never been in, and going together as a group and having a central meeting spot and working with the HAV Coalition. We get to meet some of the folks that are on the call tonight that we haven't might have worked with, and why we're all striving for the same thing, for healthcare for all Virginians. So
yes.
Thank you, Josie. Glad you appreciate you joining us.
Yeah, no, I'm gonna stick around. I want to know more.
Sounds good. Thank you. And now I want to turn it over to Becky and Freddie, who kind of leading the charge, and to talk a little bit about what's going on at the General Assembly right now, what are the updates, and then what do we need to do to prepare for Monday. So I'm going to turn it over to you two.
Well, thank you all for joining this call this evening. You obviously got me in my pajamas. It feels like it's easier to fall asleep in my clothes for the next day at this time during legislative session. It's a busy time, a lot of early morning committee meetings, a lot of late nights, but it's always really exciting this time of year in the Virginia General Assembly. And this is our long year. So that means that we get to work on this policy work until mid-March, really. So that's not very long time, and as you imagine, there's a lot that goes on in that time frame. So we're really excited to get things going and talk about the bills and the things that are important to us. So I just want to share a little bit about the HAF Coalition. It stands for the Healthcare for All Virginians Coalition. It started, I think, about 10 years ago, and it was really a response to try to get Virginia to expand Medicaid. This was when the ACA was passed, and obviously states had decisions to make. And we knew the importance of expanding Medicaid for so many families in Virginia, and especially for adults who didn't have any children. So we kept on working on it, and I think Becky actually was working on this much longer, much more furiously than I was when I joined. I joined just in 2018, and that's when Medicaid expansion was passed in Virginia. So it was a long, hard fight, and thankfully, we have Medicaid expansion, and that's thanks to a lot of the advocates that are here today, but also you'll meet on Monday, and also some of the legislators that you'll meet on Monday too. Since 2018, we've been pushing and pushing and pushing to increase access to health coverage, to increase affordability to health coverage, and increase access to services that people need. We've also really teamed up with a lot of folks to defeat bad things that come our way. There's been proposals to introduce junk health plans in Virginia, and we know that especially for folks with prescription drug needs that are expensive or medically needy in any way, those types of junk plans that don't cover everything that you think they cover until it's too late. It's just not a good deal for people in Virginia. So we've been thankful to push back on that and continue to have access to comprehensive coverage here in Virginia. I'm happy that today I can share with you we're pushing on this bill called Cover All Kids. So this is a proposal that would expand access to all children, all low-income children, regardless of immigration status. So essentially, there's a group of kids, about 13,000 in Virginia. They cannot access Medicaid. They cannot access CHIP. They cannot access ACA coverage. And oftentimes their parents are working in jobs that are not really going to offer health coverage. So they're left with no options. And we know that about 50% of these children are uninsured. For context, the total children's health insurance uninsured rate here in Virginia is less than 5%. So that's a big gap, right? So we're hoping to join the about 13 other states in Washington D.C. that have passed a proposal like this. And again, this is for families, really, like a family of three earning about $53,000. This is the proposal for those families, and asking those families to pay out of pocket for school immunizations, or if their kid gets sick or injured, right? That's asking them to pay out of pocket can certainly cause a lot of issues and stress for the family. So we're excited to be working on this. This is our third year with this proposal, and it passed the Senate last year until it eventually was not successful in the House. But we're hopeful that we'll get some more traction on it this year. So that's a little bit about our main proposal. And yeah, I just want to share a little bit about the HAF Coalition. I'm happy to answer any questions on the coalition or the policy itself. But otherwise, I'll pass it back to Becky to share anything that your wisdom.
I wanted to add a little bit to what Freddie was saying, because any bills that are coming before the House and the Senate in Virginia, especially the insurance bills, we have a fairly good chance this year of getting those bills passed. We have a very narrow majority of Democrats in both houses. I'm not trying to be partisan, but typically speaking, the Democrats have been supportive, more supportive of our measures than the Republicans. That's not to say that we don't have Republican assistance in this. So I don't know. I'm thinking we might do fairly well. The committee, the House of the Assembly started the second Wednesday in January, which was the 10th of January. What is it? We're almost 2 weeks into the session, but the committees are just really getting cranked up now, and they're going to be moving at warp speed, because then we cross over. The bills have to be out of the houses of origin by, what is it, like February 8th? Freddie, I haven't looked to see when crossover is. It's right about that time. It might be
It's Valentine's. The first day
12th.
after crossover is
Yeah.
Valentine's Day.
Thank you. The
Yeah.
following week. Yeah.
It made a good excuse for my wife, because I was like, "Oh, it's crossover. I forgot to make reservations. I'm so sorry." No, I'm
Oh,
just-
yeah. You can give her a crossover gift, Valentine's Day. So anyway, yeah, that's what we're up to now. The Commerce and Labor Committees, or the Labor and Commerce Committees, which handle the insurance bills, are just now getting cranked up and working, and our bills haven't come up, but it won't be that long before that happens. So I'm cautiously optimistic that we'll do all right this year with those. We have, by one person in each house, a majority Democrats. So we'll keep our fingers crossed that this will happen this year. A little bit about the session. As I mentioned, the session started the 10th. It will be over around mid-March. This is our long session. Freddie didn't tell us how many days, but it's 60 days. And that counts, I'm looking at Josie. That counts Saturdays and Sundays. They don't meet on Saturdays and Sundays, but they still count those days of the week as part of the General Assembly session. So it's very, very fast, but not as fast as the 45-day session. So that's a good thing. That's a general overview. What have I missed, Freddie? Anything that you can think of on that?
Yeah. So just some additional context for folks who aren't as plugged into Virginia legislative happenings. We just recently had an election in November, and that also coincided with redistricting. So what that meant was we have a bunch of new faces in the General Assembly building. Okay, a lot of new faces. It was pretty unprecedented. I don't have the numbers offhand, but it's fair to say that there was a very large changing of the guard, if you will. So I think this is a really awesome time and an opportunity for all of us to kind of introduce ourselves and introduce our organizations, our priorities, and let them know who we are, and let them know what we care about. So I think that's one thing that it's important to note. I think another thing that would be important to know. Well, so I guess I could give a little bit about logistics a little bit later, but um, I just want to emphasize for folks maybe who haven't done this or haven't done this in a while, legislators or their staff are not the experts you think they are. um, they are often very smart people, and often have passion about specific topics. But in many cases, you are the expert when you're sitting in the rooms with them, and your lived experience is really volumes of information for them. So I just it it's a shiny new building. There's shiny people inside, and and there's a lot going on. But I think it's just important to remind folks that these people are human, that they are interested in learning, and probably will be listening more than talking during our meetings, and that you know it's you I just want to encourage folks to really live in the moment with in that time, and really trust themselves and be confident about what they're saying and sharing in terms of their experience and why it matters and why it should matter to legislators. And yeah, I see Josie. Yeah, what's up?
Yeah, well, I was gonna put my former staffer hat on, and I was just gonna say, as a former, so I work for both Senate and House members, and a lot of the times you won't be able to get some of these members because they're busy on the floor and they're doing this. But these staffers are basically like the mouth and the earpiece to these members. So they're also really important because they're the ones that go back. Like I remember I would sit with my member and they would be like, okay, Josie, what meetings did you have today? You know, like what is important? So, you know, telling the story to a staffer is also just as important as telling it to a member because they basically build their agenda. So yeah, like again, going from a former staffer, it's always good to meet with them too, because they're really the ones that are moving the members all over the place and they kind of like narrow it down. Like I had my staff that I would that I had like, you know, the health folks, you know, the transportation folks. So, you know, they know a little bit about a lot of things. So, but that's why I'm telling you that that story is so impactful, because if you hit with that personal story, that's going to make the change so that their member can get involved. Anyways, my little 2 cents. Sorry, guys.
Remember, we're gonna meet between, I know Freddie, you're gonna go over the logistics between 9 and 10:30 in the 7th floor conference room. But from 10:30 to 11:30, we'll be down in the cafeteria. So I hope you will come down and we'll see if Becky's right about the coffee and the food. We'll be down there reading, and if you guys want to grab something to eat before you head out, we'll be there as well. So
Yeah. And I would say that I had another client who had a meeting today on the 7th floor, probably in the same conference room, and it's a very nice place. Easy to get to. You know, the signage is good. It's really nice.
Great. Well, so I'll touch a little bit about kind of what to expect from between here and now, and also kind of day of. But you know, we'll be sharing some more information via email or you know, uh, so we currently have, I believe the number is 15 appointments with legislators. That's great. I mean, that's a really great number, especially for the size of this group. We're still waiting to hear back from a couple of legislators, so we're giving them until Thursday to respond. And once Thursday hits, we'll be able to share a full schedule with times. Um, Obviously, we want people who are constituents of the lawmakers to be able to speak with them. As a constituent, you have special privileges, which is basically that they have to listen to you more because you
Because
vote for
they're
them.
beholden to you
Correct.
to vote for them.
So we'll be sure to kind of flag that for folks. But so Thursday you should be receiving a schedule. Also, final digital one pagers could probably be shared at that time too. We'll be printing off one pagers and have folders for you as well. So once you get to the 7th floor into the conference room, we'll have folders for you that will be ready to go. So you can just pick up with a couple extra copies so you can hand to the legislator or the staffer that you're meeting with. Logistics wise, it's brand new building, right? And the entrance for the general public is on Main Street. So
Broad.
is it Broad?
It's
I
on
thought that
Broad.
was,
Yeah.
oh, it is Broad. I'm sorry. Yes, Broad
Yeah, yeah,
Street.
yeah. It
Yes.
may look like Main Street, but it's really broad.
Yes, it is Broad. And so the entrance for general public is on Broad Street. I recommend this during this winter time. I have 15 layers on with a million pockets. So I recommend before getting there, just stuffing all of your keys, all of your like electronics into a bag if you have a bag, or at least have it one place because that will make the check-in process much easier to get through security. Security is just metal detectors, no ID or anything, so don't fuss about that. But you know that should hopefully help as you enter. Um, we have the room at 9, but you know I would recommend getting to the building itself probably a little bit earlier just to get through security and make your way up to the 7th floor. So I'd say maybe like 8:45 or so. That way we can enjoy the continental breakfast that we all have, as well as the coffee and greetings from lawmakers that will be there.
I would also add that, and you probably won't do this, but committees are meeting in the mornings and on the second and third floors, and those are open to the public. The nice thing is you can go to the door, you can look inside. There's monitor screen on the outside and it's closed caption, so you can see what's going on. And if you want, you can go in and have a seat and listen to what's going on. Open to the public.
For you overachievers that want to join into
Yeah,
a
for the overachievers in the group, and then we'll be seeing who is in there, so we know who the overachievers are.
So yeah, the elevator, there's like 8 elevators, maybe 6.
Oh yeah,
And
nice.
so you would make
And
your
there's
way.
stairwells if you want to walk.
There are stairwells. Sometimes the elevators can get crowded depending on the day, but I think we'll be okay. And we head up to the 7th floor. Folders will be waiting for you. Food and coffee will be waiting for you. And you'd already have some schedules, but then we'd kind of break up into our groups and kind of think through next steps there. I know that for folks, HACA and VHF folks, you'll be hopefully joining them for Sunday get together. So hopefully you'll get some more information for certainly for the VHF and HACA folks. And then our HAF folks will be meeting that day of at the 7th floor conference center. I think that's kind of like all that kind of came to mind. You can dress as you are. You could dress up. You could dress comfortably. It is your General Assembly building, and yeah, I think that's it. But if folks have questions about the day of or what to expect coming up, this would be a great time, I think, to ask those questions.
So what questions? Because I know this is a lot, and some of you have been there before, so it's pretty basic, and some of you have never been there. But the good news is you are among friends that we'll all be there. We'll, when you have meetings, you'll go to your meeting, but you might have some of your VHF or HACA or have coalition friends come with you. It doesn't, just because it's your delegate doesn't mean only you have to go. Lots of times people like to kind of go together. We ask that the constituent be the lead and be the main talker, but they're there to provide support and additional information if you need. We'll have the schedules. For some of you may not have appointments, that your delegate or senator might be busy, but that's okay, because we'll have packets for you to drop off, and you never know, you might see them in the hallways, or encourage them to come and contact you or reach out at another time. So if you don't have an appointment, that's fine.
I will say, if you didn't receive an email from me with all of that information for our HACA and VHF folks, let me know and I'll resend it. But that has some of the logistics as well too, like places to park, what time to arrive, what you're allowed to take into the building, and that sort of thing. So, yeah.
My biggest advice. Oh, go ahead. Sorry, Heather.
I was going to say, I'm going to resend it to everyone as well.
We're going on January 29th, which is different because typically we've gone on Martin Luther King Day for those who've been before, and it's been really, 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 really crowded, and we would have to wait quite a bit. I don't anticipate the line will be long, but I don't think it could hurt for you to get there early. To maybe do a little tour of the place, to check it out, to be an overachiever and go with Becky to one of the committee meetings. So I would not wait until 8:45 to get into the building. My advice would be to try to go early, to try to find parking and figure out what entrance, because it is all new. So just be thoughtful of that. Brenda and Robin, I'm going to put you two on the spot. Heather and I will plan to meet everybody on the 7th floor conference room. Brendan, Robin, for those of our folks, they will be spending the night in the hotel. And so I know they would be happy to meet you downstairs at the hotel and walk over with you to the General Assembly. So we will get.
Oh, go ahead.
We will get some information about what time to meet Brenda and Robin downstairs if you wanted to walk over there with them. So
yeah, I think that's a very good idea. We should definitely do that.
Josie?
Hey, Kelly, I was just thinking about this, like a little tidbit. When you go into the meetings, y'all, what you should do is definitely try to ask for a photo with the member or the staffer.
Oh,
Because at the end
yeah.
of the day, they're politicians and they love, like this is like free
Oh, they
advertising
love
for
it.
them.
Yeah.
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 So
In
if you
fact,
like
they'll,
tag
if,
them, yep.
yeah.
Yeah,
And
they
if
love that.
they,
And then they become like really like, sponsors of this stuff because they're like, yeah, look at me over here, at the Capitol meeting with my constituents. And they just love that. So if you get a chance to take a photo, tag them on Instagram, Twitter, and all the stuff that you can get on social media, because that way, that exposure is out there for them. And then they become, somebody that's now on our side. And
Thank you, Jo. And that's a good reminder because in the past too, we've had a follow-up meeting thing that people would turn in, but instead of actually writing that down, I think everybody knows, Brenda's, Heather's, mine, cell phone number. You can text us or call us, but we'll also be in that cafeteria. So come down, let us know. Be sure you send us your pictures so that we can also post it from our end. Let us know about how your meetings went. Are there folks, delegates or senators that you think Becky or Freddie need to follow up with and talk to more? Did they really seem interested and wanted to be a leader on some of the Cover All Kids legislation, or were they talking about something else that you think we might need to know about? So be sure to come and join us for down in the cafeteria after we have the meeting space, and let us know about how your meetings went so that we know how to follow up and can make sure we continue the advocacy after Monday.
Yeah,
and some of you may want to go and watch from the gallery. There is a nice tunnel. I haven't been in it yet, but you can take the tunnel from the General Assembly building over to the Capitol. You can go from the Capitol all the way down the hill to where we used to hang out before the new building was built. So
and I think they have tours too of the Capitol that are really, really good. So if you've never done a tour of the Capitol, I would encourage you to check that out as well as go up to the gallery, and you can hear what's going on the floor and things like that. So and we can be sure to tell you and guide you to what's going on. I know Becky and Freddie will have a better sense on Monday about what might be of interest. So don't hesitate to ask and let us know, because sometimes I know for me, I think you can read my mind and realize you can't. So ask us and let us help guide you and direct you or answer any questions you might have.
Freddie, have you taken the tunnel yet?
Yeah, I actually took it today.
I gotta do it.
Yeah, so if you go to the lower level in the General Assembly building, you can go to the tunnel and connect to the Capitol without having to go back in through security. So it just saves you some time, and if it's cold out, then you won't have to deal with that. But definitely worth the trip to the Capitol. It's beautiful. To poke around and look at all the beautiful sculptures and paintings. And I was just gonna mention that I think this is my final thought. I don't have many thoughts at this time of night at this point. But I think this is my final thought. Yeah, if you have conversations and as I mentioned, there's so many new faces in the General Assembly building. We have no idea, how, hemophilia or, any bleeding disorders have impacted the lives of the legislators, family members. And if you do hear about, that opportunity, I think that's a really great thing to share with Heather or Kelly. I think, this year there's no active legislation in the General Assembly building that's really on that. Maybe I'm off on that, but
Well, the bills that I'm following are all insurance bills, because that's
yes.
been an issue for us, is making sure that insurance is accessible and will pay for the treatment for hemophilia. So I've got a bunch of those, but
Oh, I see.
Yeah.
But moving forward, that's what ways that you can find champions and legislators that get it right, and have a personal connection with this stuff. So that would always be a really important flag for Kelly and Heather and all them. So
that's cool.
Yeah.
As we wrap up the hour, any questions, comments, anything that we can answer today for you?
Are phones allowed in the building?
Yes.
That you don't know, like you're the expert on your story and you tell that, but if they ask you something and you don't know, please make sure you say, I don't know, but I'll find out and I'll get back to you. And those are great things to bring back to us, to bring back to Freddie, to bring to someone and just let us know, and we could be that resource for you and get back in touch with them.
Yeah, grab their business card. That way we know. And yeah, perfect.
I mean, it's gonna be a great day. Sunday night's gonna be
Yep.
fun. Monday's gonna be fun. We're gonna have a good time. You don't need to know everything. If you don't know, you just tell them, and you tell them what you do know. And part of that, I think, like what Freddie mentioned, is lots and lots and lots and lots of people are new. So part of it is just introducing them to who you are and what's important to you, which is access to good healthcare. So it's gonna be great. And we're here to support you. We'll be there. And it really is fun. So I can't wait to see everybody. And I'm so glad we'll be back together in person together. So go ahead, Daniel. Sorry.
Yeah, just to be clear, what is the goal here to push the talking point, push cover all kids bill and relate to that with personal antidotes, or what exactly is the objective? Or just be a hemophiliac?
That is a great question, and I think the answer is you named it. We've got the talking points for the cover all kids, and then you talk about your own experience.
Yeah, and I think folks should feel comfortable leading with what they're passionate about, right? And if that's just introducing Virginia Hemophilia Foundation and HACA to the legislator, that's all right. Because there will likely be someone on hand to talk a little bit more about Cover All Kids. This is certainly a collaboration, but we want folks to feel comfortable and speak on what they're passionate about, and not necessarily try to bend their experience to fit any type of
Right.
agenda. So yeah.
Oh, okay. I got it. Okay, so like me personally, like I'm impassioned about continued Medicare access, low income access, uh, maintaining what we've built in Virginia and potentially expanding it, but obviously maintaining it in the sense of, avoiding any downgrades to it, and expanding it, just expanding access in general. So are you saying, like, go in and talk about that, and maybe
Yep.
cover all kids can be mentioned in relation to that, because that kind of is an expansion of,
That's
healthcare
exactly it.
access tangentially related to Medicare, you know?
It's actually what we're talking about, is making sure everybody has access to healthcare. Yep.
You got it, Daniel. I mean, I don't think
Okay.
we could have said it better. I mean, it's
Yeah,
part
no,
of
that's exactly it. Yeah,
Exactly.
you're just letting them know that these are the things that are important to me. I like them to maintain this way. And like you said, in the expansion part, I would like to see this also happen. But, sometimes you go in there, like I'm used to going into states and asking, but sometimes like in Oklahoma, we went in there and it was just like a thank you, thank you for keeping it like this, keep it the same, kind of thing. So yeah, you're right on point on that, Daniel.
Yep.
and meeting them. And sometimes it's just introducing yourselves. You haven't met them before and you want them to know who you are and what's important. And one of the things that your group is working on is cover all kids. And you give them the flyer. And if they want to talk more, they can follow up with Freddie or Becky. And you're glad that they're taking the time to get to know you. And when bills come up about insurance and access, you want to make sure that they remember that and vote for things that help people with chronic illness.
Yep.
You got it, Daniel. Oh, I can't wait. This will be fun. Anything else before we wrap it up?
How much it's probably in the email. How much time do we have before we start setting out for our scheduled appointments, where we're meeting beforehand and then we start setting out for scheduled appointments?
We're going to send you the schedule, Daniel. So I don't know what time your appointment, I think yours might be earlier in the morning, maybe, if I remember correctly. So we'll send you an email about what time your appointments are. So they might
let's
be.
let's just pretend for a second that I'm
Okay.
the first one on the docket.
Okay.
How much time do we have where we're all together and we're still prepping until the first person heads off to their appointment?
It'll depend. So let's say, for example, your appointment's at 9 o'clock.
Okay.
You probably come in, you have our cell phone, come check with me. I'll be outside that conference room before 9 o'clock and say, okay, my appointment's at 9. I'll say, hey, Daniel, I think Carla might want to go with you, or Faith wants to go with you. And then you guys go to your appointment. And then that's a great question, Daniel. And then after your appointment, which probably won't take very long, maybe 5-10 minutes, maybe, then you do your thing and then come back to that conference room, because that's kind of be our central meeting spot. So then you come back to that conference room, because then we're going to hopefully have aides and legislators come in that meeting room where we can greet them as they come in, offer them breakfast, give them our handouts. And then let's say you have a meeting at 9. So you've gone to your meeting, you come back, your next meeting's at 10 o'clock. Then we're looking around, hey, Paul wants to go with you. Brenda wants to, hey, who wants to go with me to my 10 o'clock meeting? You guys go to your 10 o'clock meeting, and then 5 minutes, 10 minutes maybe, and then you would come back to kind of meet up. And we'll have that main room till 10:30. So that's kind of like our hub. So depending on what your time are, you may have some time to prep beforehand, and you may not have really any time, but we will be there before 9, kind of hanging outside the meeting space. And you have our cell phones and texts, so we can hook up with you too beforehand. Does that help?
Yeah.
Okay. So basically make sure our phone numbers are plugged in, text us, call us. We'll be outside that meeting space, and people will be coming and going for that hour and a half through that whole time. And usually we'll get people want to go with, like, let's say, Carl and Dan, you guys have the same legislators, you would go together, but usually people want more experience or want to go. So, maybe Faith and Jackson want to join you. You two would be the lead.
Matt's a great one to take with y'all too.
Yeah, or Matt. Yeah.
Yeah.
You two are the lead because you're the constituents. We want you to be doing the talking, but other people are there just for moral support. And if a question comes up, you're not sure, that they might be able to chime in. So. But that spot that we have for an hour and a half, that's kind of like you always come back there after your meeting to kind of regroup and to greet the legislators and aides that might be coming for breakfast to join us, because we'll have talking points and handouts to pass out to people who are coming in. Any other questions? But Heather will be sending out the logistics again to our folks. And I know Freddie's sending out folks who are part of the HAV. You have our cell phones. Don't hesitate to call, text, email, any questions, concerns now or the day of or whatever, because that's part of it. Like, we want to help, and there's so much energy. It's going to be a great day. Brenda, Robin, any last minute? Heather, anything else that we forgot?
No, I'm good. I think that's pretty good.
So part of that, we haven't done this in 4 years, so we're going to figure it out. So we'll work together to make it happen. So thank you all tonight, and appreciate you being here. And Freddie and Becky, thank you guys for all your hard work and helping to make it happen. And we'll be in touch this week, and see some of you Sunday night, and the rest of you on Monday.
Thank you so much.
Bye, everybody. Thank you so